These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIB is funded by the National Lottery Community Fund.
Good morning, everybody, and welcome to the CATHIB Health Hour, 2nd of December, 2023. It's strange that we should be, within such a short period, getting to the end of the year. It's only yesterday when it was January, but I suppose such is life. Today, it is my pleasure to introduce Professor Ibi Erekosima, who is going to be talking to us about kidney health, renal medicine, really. He'll be giving us the ins and outs and the ups and downs of renal medicine, your kidneys, what can go wrong with them, how to get them right, and all of that. Professor Ibi is a renal physician, and he works with the Salford Royal University Hospital, and he is involved with general nephrology, acute medicine, renal transplant services, and dialysis services. Additionally, he's a clinical teacher, and he teaches at the University of Manchester Medical School and the University of Port Harcourt. Professor Erekosima is a fellow of the Royal College of Physicians in London. And Professor, we're very grateful and we're very glad to have you with us this morning. These health hours are provided by CAN, which is the Caribbean and African Health Network, in association with our other partners, the Black Health Initiative from Leeds, the Royal Assembly, Redeemed Christian Church of God from Sheffield, RAFA, International Development Agency, the Croydon BME, Black and Minority Ethnic Forum from South London, and Enfield Caribbean Association. We're grateful and thankful to all our partners for helping us put these talks together. Whilst a professor is speaking, please remember that there's a chat function you can use, and you can make comments, you can ask questions. And also, we would be very grateful if you could tell us using that where you're tuning in from. We like to have a good idea of our global reach. We've had people tuning in from all over the world, and that gives us great pleasure. Right, without much further ado, I will hand the reins over to Professor Ibi Erekosima. And Professor, the floor is yours.
Yeah, thank you very much, Mike, for your kind introduction. I've always been part of CAN, talking about the kidneys. So it's a great pleasure, as always, to share some basic information on looking after your kidneys. That's where I put it. So I'll share my screen now. Mike, if you can see my screen, just give me a thumbs up. Okay, thank you very much, Mike. So Basically, you all know who am I? I'm a kidney doctor. So that's what I do. Um, so just as a brief outline on what I want to talk about, I'll just talk about introduction, background, and what is chronic kidney disease. And as a prelude to that, I'll talk about kidneys in health, and then look at the risk factors, symptoms, and stages of chronic kidney disease, and management and prevention. Then I'll conclude. Basically, I'll try and use very less medical jargon so that it is very clear to everyone on this in this audience. So the kidneys are two small bean-shaped organs, usually at the back. In medical terms, we say posteriorly, but it's at the back. And there are two bean-shaped organs. Now, it is the hardest working organ in the body. Well, some of my other colleagues always say, well, the heart works harder, but I think the kidneys work harder. The kidneys filters around 180 liters of blood 40 times in every 24 hours. Can you see that kind of thing? It's huge. And it's just about the fist of the size of your fist. And a powerful chemical factories, actually, and ensure that your chemicals are balanced and they get rid of toxins and unwanted chemicals. So those are the things that you should just have in your head as we go along. So this is what the kidneys look like. They're two bean-shaped organs, which I've mentioned before. They just make urine, and it's stored in the bladder, which I call a tank. And when you're ready to void, you pass urine. And so when the kidneys are not working well, urine is produced, it's also affected, and over time, your urine tail off, especially when you go on dialysis. So what are the specific functions then? So like I mentioned in my previous slide, that they clean the blood of waste products and extra water. And that's why you can see that you're not feed overloaded and everything seems all right. It helps control your blood pressure, and the kidneys are the seat of blood pressure control. It's not the heart. The heart contributes to blood pressure control. Blood pressure in your body to make sure that your body has a kind of a mean arterial pressure. Mean arterial pressure means that no pressure to pump blood to all the tissues, but it's the kidneys that control the blood pressure. So it keeps your bones healthy and strong because it activates vitamin D that most of us get through our skin from the sun. So it makes red blood cells by producing a chemical called erythropoietin, which stimulates your bone marrow to produce red cells. And then finally, it keeps your minerals in your body, your salts, in a balanced state. So it makes it keeps your sodium, phosphorus, and potassium in balance, which are, in other words, affects different cells in your body. So this is, if I slice the kidneys in a cross-sectional ways, this is what you see. That if you now look at it, each of these spots, that this particular spot that is highlighted under the microscope, this is what you see. And so you can see the filtering components of the kidneys here. And so urine is made and it goes through the ureters. Ureters are tubes that connect the kidney to the bladder. So the blood vessels go in, the renal artery goes in, it cleans the blood, it now gets it back through the vein. So when you look at it under the microscope, this particular bit that is highlighted, you see some wriggly things. This is the filtration component. You can see how wriggly it is, as your blood is filtered along these wriggly tubes. And this is what we call the nephron, and it's the filtering unit of the kidney. And there are 1 million of them in each kidney. So to repeat myself, there are 1 million filters in each kidney when you're born. So the kidney is just a fancy sieve, which I've mentioned before. You can see a lot of stuff which is filtered very nicely, but you can see a lot of stuff that is in the urine in disease. So the kidney filters good stuff and keeps it back to the body and then releases bad stuff. But when the kidney is diseased, both good stuff and bad stuff are filtered out. And then, in fact, the bad stuff is now retained in the body. So this is just a summary of what I've just said now. a healthy kidney and the filtration process, which happens as the kidney is here, it filters the blood. It's unfiltered blood, it enters the kidney. The filtration unit, which I've mentioned before, now filters the blood, and then urine is formed. It drains into this tube, which is now stored in the bladder, and you pass urine when you're able to and feel like passing urine. So that's a summary of it. So the filtered blood goes back to the body. So this is just a summary of the functions, which is most people have two kidneys, which I've mentioned before, and they weigh about 150 kilograms. And this is something I mentioned. So there are 140 miles of tubes and million filters, and a million filters in your kidneys, which I've just mentioned, and is the hardest working organ. I repeat that. 25% of blood from each heartbeat is filtered by the kidney. And most of the kidneys sit at the bottom of the ribs, which is at the back, and that is already described. So what do they do? I just to recap of what they do. So this, I've mentioned this before, but something that you should also have there is remove many drugs that some people take for other conditions. So it also makes sure that you don't get drug overdose. It kind of clears some of the drugs. I mean, when you take medications, it makes sure that it's not accumulated and it is getting rid of after it has made its effects. So this is what it is. So just finalizing: water, blood pressure. It makes sure that you don't have too much or too little water, blood pressure, weight, bones. Make sure that the salts are balanced. Your heart is in good state because your salts are balanced, and make sure that your heart beats properly because the salts control the way the heart beats, and then it makes erythropoietin. So that's the basis. So now that brings us to, so what is the kidney like in disease? So the term chronic kidney disease means lasting damage to the kidneys that can get worse over time. And it means damage to the kidneys, hence it can't filter blood the way it should. And so there is progressive loss of kidney function that sometimes occurs over many years. And so we define chronic kidney disease when you have abnormal kidney function or structure present for more than 3 months. So I've shown you the way the structure is and what could happen. So these are the commonest causes of kidney disease worldwide. You can see the percentage, 42% in the red one, which is type 2 diabetes and high blood pressure. And now these two, and then the glomerular disease, which is inflammation of the filtering component, inflammation. So forget the mouthful word there, glomerular. Glomerulus is those regular things that I showed you in the previous slides. And so these are, you can see the 3 common things in type 2 diabetes, high blood pressure, and inflammation of the kidney. Other things cause it. In type 1 diabetes, kidneys are not affected early in the disease, but in type 2, which affects older people, kidneys are affected early. So that is it: diabetes, hypertension, glomerulonephritis, which is the inflammation of the filters. Now, polycystic kidney disease is the commonest genetic cause of kidney disease, which is inherited as a dominant gene in people who are affected. And it's not a common disease, but it is there. But it's the commonest genetic disease. So this is what happens in chronic kidney disease. You gradual loss of kidney function. You become, as the kidneys reduce their function. These are some of the things that happens. I've already mentioned that it's common in diabetes, high blood pressure, and glomerulonephritis, which is a mouthful word, but it is just inflammation of the filters. And so what happens is that at the end, you got dialysis, which could be hemodialysis or dialysis through the tummy, or you get a kidney transplant when the kidney is less than 10%. So what is the impact of this problem that we have worldwide? So 50 million individuals suffer from progressive chronic kidney disease. And so if you look at the developed world, more than 1 million people are treated with some form of dialysis or have had kidney transplant. And so if you look at the data, just for information, of the WHO ranking causes of death, chronic kidney disease is the 12th on the list. And one of the causes of death in people with chronic kidney disease is linked to cardiovascular disease because it affects your blood vessels at the same time when diabetes affects the blood vessels, which causes kidney disease, and also hypertension, which affects the blood vessels. And so they are just intertwined. I'll show you some cartoons to show the relationship. So kidney disease in this country affects everyone and there's no cure, but we can slow the progression, and that's part of my job. And also part of responsibility of those that have kidney disease to help themselves to slow the progression. And that could also keep the kidney stable for a long time if you look after yourself. So around 3 million people in the UK have some form of chronic kidney disease. And it is important to note that 1 in 10 people have some form of chronic kidney disease, but in the early stages of the disease, there are no symptoms. And so most people can just be walking around with no symptoms. And so the two biggest causes in this country of chronic kidney disease is diabetes and high blood pressure. Like I said, if you look at the major other causes, you have other causes, but the two major causes are these two disease entities. So right now, there are 63,000 people who are being treated for kidney failure where kidney function is less than 15%. But this is a kind of a gross figure, but most times, most usually as a kidney physician, we treat patients for kidney failure when kidney function is less than 10%. So by 15%, begin to plan your treatments pathway. But the most important information here is that the Black and Asian and minority ethnic communities are 5 times more likely to develop chronic kidney disease than other groups of ethnic groups. And so this is a source from Kidney Care UK. If you just Google Kidney Care UK, you see some of this information. So I put this slide so that you're all aware that what we're seeing is almost like the visible things that are expensive component of kidney care. So, and that's the essence of some of these drugs, which is the looking after your kidneys. Which a lot of them, if you look at a typical iceberg, and what we're seeing is on the top, but you can see there's a huge chunk below the water. And so most of the people that are at risk are under the water, are not visible. So the visible things we're seeing are people who have now ended up with end-stage kidney disease and are not on some form of dialysis or transplant. But the huge population of people who have chronic kidney disease are just not visible. And so that's something that you should think about. That, like I mentioned in some of the slides, you don't have any symptoms, but when you have these risk factors, you should look after yourself. And those are the ones that are probably under the water. So I put this in ethnicity and type 2 diabetes risk because we're still talking about risk. The South Asian population living in the UK are 6 times more likely to develop type 2 diabetes, in essence, and have a kidney disease in the future. And when you look at the African Caribbean descent, are 3 times more likely to have type 2 diabetes than the white population. So you can see that we are at high risk. So what's the relationship between the two? I always say that both of them are almost like Siamese twins. So hypertension is twice as frequent in patients with diabetes compared with those who do not have diabetes. So patients with hypertension often exhibit insulin resistance and are at greater risk of diabetes developing than normal individuals who don't have high blood pressure. So this is well documented in research and literature. At 85.1% of type 2 diabetes patients have hypertension, while 6.9% of hypertensives are diabetic. So that's something that you should bear in mind. So this is all the risks that are involved, and most of these things are within the reach of people who can. I mean, if you look at the risk factors, diabetes, high blood pressure, heart disease, they're all linked to chronic kidney disease. So the older you are, your likely risk is high in the presence of other risk factors. So this is the relationship I was talking about. You have diabetes, hypertension, chronic kidney disease, they're all intertwined, and so that's something that you should know about. And so I put it down to cardiovascular disease because see, chronic kidney disease, diabetes, and cardiovascular disease. And in fact, as your kidney disease gets worse, your cardiovascular disease also gets worse because you're likely to die from cardiovascular disease. And you could die sooner. So one of the things that you do, the reason for some of these health talks is to be aware that, well, you have to look after myself because there's a relationship between all this. And then in general, for those that don't even have this, so this is important information we should have. So just other things that can affect the kidneys, just buying some of the over-the-counter drugs, especially non-steroidal anti-inflammatory agents, should be something that we should be worried about. The two things I want to emphasize on is non-steroidal anti-inflammatory agents and dietary remedies and dietary supplements. Don't get me wrong, I'm not saying that dietary supplements are not good, but there are some that people buy on the internet which do not have any real approval from the FDA, which is the Food and Drug agencies. So you can see what herbs can do to the body, to the kidneys, where there's a lot of things that happen: correct processing, correct storage, adulteration, especially from the African Caribbean descent. I mean, we use a lot of toxic, all these herbs and things where people tell that, oh, it will do fantastic things in your body. So you should bear in mind that these herbs are harmful to the kidneys and could cause future problems. So this is what happens when your kidneys are diseased. You can see this is nice and pink, and this is looking shriveled and shrunken. So this is just a picture of what happens, so you can take this as a takeaway message. You can see that the healthy kidney, the filters are working well, things are put back, the urine is nice and clean. You can see the urine is just filled with some good things and some things that probably not supposed to be there. So this is just to remind us, when you have a kidney disease, we stage it as doctors or healthcare professionals. So the healthy kidney, everything is all right. The diseased kidney, what I showed you the previous slide. So we put the kidney disease in stages, and this is where I mentioned that you have an established kidney failure, and begin to plan then based on your symptoms. When your kidneys are less than 10%, we will now talk about transplants and dialysis. So these are some of the symptoms of chronic kidney disease, which you can experience when you have this. So it's a silent killer, which I mentioned most times. There are no symptoms even up to chronic kidney disease stage 4, which I showed in the previous slide. Up to this point, sometimes some people may not have much symptoms, but most of the symptoms begin to kick in when you have chronic kidney disease stage 4. And so from stages 1 to 3, if 1 to 3B, nothing happens. But there are other indications that could show that your kidneys are not working well. You could do look at your urine, look at your bloods. That will show that your kidneys are not working well. So these are the symptoms when your kidney function goes to stage 4 and less. And so you begin to feel all this, you're going to be bubbling and some of the things. Now, sometimes even at stage 1, your urine can be bubbling because you got a lot of protein in the urine, but your kidneys are still not damaged to the point that the percentage of filtration is reduced. So these are some of the things that can happen. You can have loss of appetite, tiredness, nausea and vomiting, and swelling, because I did mention at the beginning that the kidneys get rid of water and make sure the minerals in your body are in good shape. And so when you have water retention, that could also be in the lungs and can cause you to your breathing problems. And some of if you don't filter some of the minerals and toxic materials, it could deposit in your skin, causing persistent itching, especially when kidneys are working less than 25%. And you could have sleeping difficulties and waking up at night to pass urine, because most of the urine we pass is useless because it contains things that are not supposed to be there. So how do you know that you have kidney disease? You do simple blood tests, you check your filtration status, which is called the kidney profile. And we could do some imaging, and the commonest imaging we do is the kidney ultrasound scan, which can show you the size and the appearance of the kidneys. And so that could give us an indication that things are not right. And then for some people who present with rapid deterioration of their kidneys, we will go further to do what we call kidney biopsy, to be able to look at the kidneys under the microscope to be sure what is going on, whether it's inflammation or something else. And then a basic urine test could check for protein and blood, which could be indication that you could have kidney disease, because you should not be filtering blood cells and urine, which I've shown before. Things are kept back in the body because if the filters are working well. So my job is, well, like I said, is to slow the progression. Those that have established kidney disease, to slow the progression. Now, I want to make the statement that many people with Crohn's are able to live normal lives without being unduly affected by the condition. And so, although it's not possible to repair damage that has already happened to your kidneys, CKD, which is chronic kidney disease, may not necessarily get worse if the risk factors are well managed. So that's an important message to take home. And so chronic kidney disease only reaches an advanced stage in a small proportion of people, especially if you look after yourself. So how do we reduce the progression of if you have established chronic kidney disease? Is treating the risk factors, diabetes, hypertension, living a healthy lifestyle, make sure you're well hydrated. I'm not saying that you should be drinking gallons of water, or that some people are advocating on the net, but you don't need more than 2 to 3 liters of water. But especially in the Western world, people drink less water and drink a lot of tea. And so we use medications to reduce protein in the urine, because you're not supposed to have protein in the urine. So we use medications to ensure the filters are kept in integrity, so that they don't begin to lose, you don't begin to lose protein through the filters. The modification of lifestyle, avoiding excess over-the-counter drugs and herbal preparations, and regular check with your primary care physician, especially when you're above age 40. You do what you call well man or well woman's health check. And when you have established kidney disease, you're monitored by primary care physician, depends on your percentage of kidney function, and they're all kidney physicians like myself. So what is the prevention and management then? So just summarizing, rounding up this talk, there is no cure for chronic kidney disease, which I mentioned before. Treatment we can reduce the progression of the disease, and you can live normal lives. Treatment can help relieve the symptoms and stop it getting worse. And your treatment will depend on the stage of your kidney, of your chronic kidney disease, which I've mentioned before. And the main preventative measures are not rocket science, are not big things, are things that are in your hands as an individual, which are lifestyle changes, and to help you stay as healthy as possible. Especially for those that have these risk factors, as Christmas is coming, those that have diabetes, hypertension, and all the other things, you should be not lose touch with the fact that you have to look after yourself. So this is what happens if the progression, if the kidney disease continues to progress and progress. And so we slow the progression, but if I continue to progress, the management of the complications, we manage the various complications, and then we prepare the individual who has advanced kidney disease for renal replacement therapy. It's a mouthful word. Renal replacement therapy is just simply, how do you replace the kidneys? And the kidneys, the dialysis just does 10% of what your normal kidney would do, that keeps people alive. And so dialysis is one of the renal kidney replacement therapies, and then transplant is the gold standard of managing people who have end-stage kidney disease. That's the gold standard, possibly giving a kidney transplant. So this is just the summary of the diagram. Chronic kidney disease, there are kidney transplant. Peritoneal dialysis is dialysis through the tummy, which individuals can do themselves after being trained, which you put a tube in the tummy, which acts as a filter, the lining of the tummy, and or you go to the hospital 3 times a week to have your blood into a machine which filters the blood 3 times. You go there 3 times a week, and the treatment usually for 4 hours at any session, so usually 3 times a week. So I always like to put this slide, and which is preventing chronic kidney disease. An ounce of prevention is worth a pound of cure, if Erasmus, which is a popular saying. So diet and exercise to maintain a healthy weight, smoking cessation, control your diabetes. For those that have diabetes, and control blood pressure or cholesterol, avoid excess over-the-counter pain medications and herbal preparations. I can't overemphasize this because this is a common problem, especially in this day and age of internet, where social media, where people offer all sorts of advice. Most of them are harmful. Treat infections promptly, especially urinary infections, and make sure that you're well hydrated and regular checkup with your primary care physician if you're concerned. So this is just a summary, especially I'm just using diabetes as an example, which is taking your medications to control your diabetes and high blood pressure, which I've shown in the previous slides, that both of them work hand in hand, and then managing changes in your eating, diet, and nutrition, and your diabetes, losing weight if you're overweight, obese, and exercise regularly. Now, some of the things, especially in the winter, it's difficult, but there are certain exercises you can do at home in yourself. If you look at some of these online advices in physical activity. So one of the things that I just want to mention before I wrap up is that it's busting the myths about hypertension. Those that have high blood pressure who may have some myths. This is very common, like in our community. So, which is hypertension is not a temporary illness that will resolve. It's a lifelong illness. So it is not because you have some personal life difficulties and all that. It is a disease that requires medical intervention. Either you have to lifestyle changes and all the other things will help, but you need to be under supervision by a medical person to make sure your blood pressure is under control. Now, the other thing to mention is the absence of headaches and dizziness does not mean good blood pressure control. You need to take your medications regularly. So there's no need to experiment with stopping treatment to see if symptoms will reoccur. And so do not stop medication because of lack of symptoms, and then do not wait for symptoms before you take your medicines. So it's something that is a routine, you take it every day. So long-term medication is not harmful, to be aware, and does not have any risk of tolerance, dependence, or building up to harmful levels. Sometimes, but obviously there's a caveat there, just sometimes medications may cause if you depending on your weight and where they're calculating the dose of your medicine, sometimes people can have side effects. Side effect is different, that is going to be harmful. So that medication could be reduced, the dose, or the medication can be changed in cooperation with your primary care physician. So alternative medicines are more effective, but may result in complications. Too little is too late. So that's something that you should be aware of for those that have high blood pressure. So how can I keep my kidneys healthy? So the tips can help you. Very simple: regular physical activity, lose weight if you need to, eat less fat, which is reducing cholesterol and all the others. Keep your blood pressure, blood sugar, fats under control, stop smoking, keep well hydrated, reduce stress. Reduce your stress means that your lifestyle does not mean that once you reduce your stress, if you're hypertensive, that could just help by reducing the number of medications, but you need to discuss that with your primary care physician. So avoid herbal medications. So these are some of the tips that you can use to keep your kidneys healthy. So lifestyle intervention, know your numbers, which I've just mentioned before. Most of these things I've mentioned in the last slide. So testing over 40s, once you're over 40, usually your GP surgery will send you a letter for those that are well man or well woman clinics, especially if they don't do it over 40. This is a mandatory thing to do it over 50. So you check your blood test to check various measurements of different things in the blood, pointing towards kidney profile, cholesterol, glucose, and also checking your heart and checking your urine, because those are things that can give indication whether you have kidney disease or not, and checking the back of your eyes. So as I summarize, your kidney health, food, exercise, habits, compliance to medications, general healthcare, environment, some things you can control, genes you can't. Environment you can control some things, but economy can't. But those are some of the things that you should be thinking about when you think about your kidney health. So just as a summary and just the final slide, most of this information to support you about knowledge about kidney disease can be found in the National Kidney Federation website, where they have all sorts of information and can put you in touch with local groups that are in your area. And also you have the Kidney Care UK, which offers resources and support, and also have a telephone counseling service. And then Kidney Research UK, which I'm very much aware and associated with right now, are now dedicated to some research now into kidney disease affecting ethnic minorities, because of one of the things I've just said. The Asian minority 6 times more likely to have kidney disease if they have diabetes, and the Black ethnic minority 3 times more. So this is just a summary of looking after your kidneys, and I'll be prepared to take any questions. Thank you for listening.
Right. Thank you very much, Dr. Professor Ibi. Thank you very, very much. That was quite a proper round trip around kidney health and kidney disease. And I'm very impressed that you took the time to repeat and emphasize the salient points that we should all be paying attention to. So people, it boils down to the fact that there's no cure for kidney disease, but it can be managed. And all of the activity is based on slowing the progression of the disease. Also, we should be very mindful that as Black and ethnic minority people, we are more prone to kidney disease than the general population. So for something that has no cure and that we are more prone to, then I think we should pay a lot more attention to it. An ounce of prevention is worth more than a pound of cure. I am always impressed with these talks that it always comes down to the basic things: diet, exercise, risk factor management. And especially these days when we are seeing a lot more health surveillance from our primary care providers, then people, it's there for us. We should engage with our GPs and get ourselves checked out regularly. The questions will come later. But Doctor, thank you so very much. And we're very grateful to you for the information. Thank you very much. I think at this stage, we move into the questions. The one question that I'm picking up at the moment is somebody who says that herbs served our forefathers very well for a long, long time. So is doctor now saying that we should disregard the herbs? Now, allied to that is my own question as well. Doctor, can you tell us if there are any particular herbs that we should be avoiding? And also, things like Maggi Cube and MSG, monosodium glutamate and things like that, do they have any effect, any proven effect on our kidney health?
Okay, thank you very much. Yeah, just taking the first question. That's what people say that my forefathers were doing this. And so why didn't it affect them? We don't have data of what happened to our forefathers. And so we now know more now what these things do. I mean, when I talk about herbs, I talk about herbs that are unrefined and all that. If you go onto the internet and go to the International Society of Nephrology website, you'll get a lot of information on most of these herbs. Now, just coming down. I mean, I just came back from Nigeria about 3 weeks ago. So I went to do some training and all that, and that is a massive problem, and it just is shut up because of people are just saying that, oh, if you take these herbs, it's going to cause problem. And now these herbs are non-described. I'm not talking about the ones that you go to Holland and Barrett to buy. I'm not talking about that. But there are people who mix all sorts of things and say that this is going to be good for. I saw an advert that was horrifying, where somebody was just saying that he has mixed up some things and that people who have kidney disease should buy. I know that that is a lie. It doesn't work. I'm not saying that, oh, because I wasn't there when our forefathers were there, but I'm talking about this day and age. So it is left for individuals to adhere to this advice or not. Now, secondly, you're talking about some of these additives that we had to our food to give it some spice, monoglutamate and all that. Now, most of them are salts. I mean, they're salty and things. So directly, they don't have impact on the kidneys. But if you take a lot of salt, of course, you know that if you have high blood pressure, your blood pressure control is going to be jeopardized. So which means that you're going to have more medications to bring down your blood pressure. So to answer to that question, there's no direct correlation between using these things these spices. I put them as spices to spice up our food to make it more tasty. But you, as somebody who have high blood pressure, should be more cautious in using those spices. Of course, it's not saying that you should not use them at all, but it must be done with some sensibility.
Thank you very much. Thank you very much, Prof. Now, the next question goes back slightly to where we were before. And one of our viewers is asking about, are there any specific dietary changes that you would recommend in terms of mitigating kidney disease? So we all know about salt and sodium. Is there anything else that you would recommend that people look at the usage of?
Yeah, I mean, the two common things that you think about based on the two common causes of kidney disease are diabetes and high blood pressure. And so things that you need to worry about are sugar and salt.
Salt and sugar, okay.
Salt and sugar. So those are the basic things. I always, when people come to see me and talk about dietary, the nitty-gritty of it, I leave it to my dietitian to deal with. And so those are some of the things that, but in just a big term, it's sugar and salt.
And salt.
Salt for high blood pressure and sugar for diabetes. So you look at all those refined sugars and all those things that can link you to diabetes, that can cause kidney disease. And then you now look at salts, which can jeopardize your blood pressure control. And let me just tell you something. For Africans, our kidneys are trap salt. That is because we live in forget that you live in England, where the temperature is low. But the way our kidneys are structured, well, we live in kind of where the temperature, the environmental temperature is high. And so we sweat a lot. And so our kidneys are adapted to our environment. And so it traps salt and keeps salt. And that's why the blood pressure in Africans is volume dependent because of the salt that is involved, and because our kidney genetically trap salt.
Okay, thank you, doctor. Now, the next question is, what are the potential complications of untreated kidney stones, and is there a cure for kidney stones?
Yeah, kidney stones. If you go to even Africa, Caribbean, and all those places, kidney stone is not a major problem for us because we drink a lot of water there because we sweat. Now, kidney stones is a problem, yeah, because people drink less. And our urine is concentrated based on and then most of the things we take are calcium, but contain very high calcium and things. So people in the Western world are more prone to kidney stones. Now, kidney stones are treated by urologists, not nephrologists. Urology means that the urological surgeon, they deal with the lower urinary tract. Now, I'll tell you why they are more in charge, because if you have a kidney stone that can't come out, they have to remove it through surgical procedure, or you blast it. So the way to treat kidney stones, number one, is to get well hydrated, so that your urine does not contain impurities, which now becomes crystallized and cause kidney stones. Now, if the kidney stone is there, it's not causing any problem, which means that it doesn't cause pain, or it has not blocked one of the filters, then you may just not notice that you have kidney stones. Now, you notice that you have kidney stones when you get real pain, and then you go to the hospital, they do a scan, and you find a kidney stone there. They will refer you to the urologist. Urologists will have two intervention modalities. One is to blast, we call it lithotripsy, to blast the kidney stone, and then it now disaggregates, and then you can pee it out, or it goes in surgically. So that is the way to treat and prevent kidney stones.
Okay, thank you once again. The next consideration is about urine. So what would you say is the ideal color of urine? How much water do we really need to drink? And on an allied front, can drinking water before a blood test make a difference to the results? I try to group the questions so that we make the best of our time.
Yes, I mean, that was very interesting, especially I'll come to the one that drinking water before a blood test. Now, urine is normally amber, and when your urine is very concentrated, two things could happen. It could look very, very, very concentrated, I mean, deep amber, and it could just foam a bit because your urine is concentrated. So forming of the urine is not just protein in the urine. Sometimes when it's very concentrated, and when you're not drinking enough. Now, how much do you drink in a day? You drink 2 to 3 liters. An average person drink at least 3 liters of water or fluid per day. So that's 2 to 3 liters. And that is something a habit that people should form. I don't drink enough, but people should drink, rather than drinking cups of tea. So now coming to the last question, which has to do with, do you do a blood, do you drink a gallon of water before you go to do blood test? So if you're well hydrated the previous night, if you're always well hydrated, your kidney, it will not affect any of your kidney tests. But if you're not well hydrated, for example, you've not drank, let me just give it example. I've had patients who have not drank much during the day, and they go and do their kidney test later in the day because of work and things. Of course, once I look at the result, I'll know that this person has not drank enough for the day because their urea will be higher than usual. So I'm not saying that you should drink gallons of water before you go out, but as a habit, just take 2 to 3 liters. So it's not an advice that before you go and do blood tests, you should drink gallons of water. No, that's not advice.
Okay. What about lemon and celery? Does that help with cleansing your kidney?
Well, in my 25 years of as a kidney physician, I've never seen anywhere in the literature that said that. I mean, this lemon is something that people use for different reasons. Some people put it in water, slide lemon, and put it inside water to make the water more palatable for them to drink and all that. But people say water is boring or something. And so people use lemon for different things. So I've not seen where because you want to your kidney health that you have to be taking lots of celery. Celery is good as a product. I mean as a vegetable or as to use, but I don't think that is linked to healthy kidneys. Just like any other vegetable, you eat vegetables as part of your healthy lifestyle.
Okay. Yes, we are 3 times as Afro-Caribbeans more prone to kidney disease, and that Southeast Asians are 6 times more prone. Are there any recognizable explanations for this? I ask this simply because you alluded earlier on. You said that kidneys are designed to trap salt, for example, over time. So is there any similar explanation for the fact that we are more liable to kidney disease? And if there's an explanation, are there ways of behavioral management that can mitigate these explanations?
Thank you very much. That's quite an interesting question. Now, the Asian population are 6 times more because they have a very high incidence of diabetes. And if you look at my data there, 42% of 42% is of the causes of chronic kidney disease is due to type 2 diabetes, and that is why they have higher incidence. So on top of if you had their diabetes and hypertension together, they will be 6 times more than Africans. While in Africans, in Afro-Caribbeans, it's mainly hypertension. Although diabetes is there, but it's not as much as in Asian. In the Asian subcontinent, there's a very high incidence of diabetes there because of their weight gain and the way they kind of their diets and all that. They eat loads and loads of chapati and all this high carbohydrate. That's from the data that is available out there. So in terms of behavioral changes in respect to all these things, is for African and Afro-Caribbeans, is diet. Our diet contains a lot of salt. I mean, we like to take a lot of salt. And so we have to reduce our salt. And in this day and age, I mean, when I went to Nigeria, I saw that there is a very high incidence of high kind of occurrence of all these fast food shops. And that is linked to most of this stuff. I mean, most of the Western lifestyle is not in our societies now. Yeah. So that's something that we should also be thinking about.
Okay. Back to urination again. Now, this, I was going to say gentleman, but I'm not sure if it's yes, this gentleman is asking if he urinates between 3 to 5 times in an hour. Is that okay?
Yeah.
And should he be doing something about this or not?
All right. So I don't know what age he is. What age is he? We don't know his age. So if somebody of 50 and above is passing urine 3 to 5 times an hour, I would tell you to go to your GP to check your prostate.
Okay. Also, again, there's a lady here who drinks a lot of coffee. She drinks about 3 lattes a day. Will that affect her kidneys? And also, does milk affect it?
3 lattes a day is nothing. There are people that drink 10 cups of coffee. You know, okay. We're not talking about going to have a drink 3 lattes of about maybe 200. I mean, maximum. Most of those cups are just about 200 mils or 150 mils.
Okay. Now, yes, I'm actually quite surprised that this one didn't arrive earlier. Alcohol and the kidneys. Can you give us some sort of insight on the effect of alcohol drinking on the kidneys? Long term, short term, medium term.
Okay, so let me just say one big statement. The alcohol, actually, the organ that it affects most directly is the liver. So alcohol is one of the number one causes of liver damage, not kidney damage, liver damage in the UK. So if you go to a liver ward in any NHS hospital, most of them are alcohol dependent. You understand? So now, how is alcohol linked to kidney disease? It's indirectly, because if you take a lot of alcohol, if you take I'm talking about people who drink on a constant basis, it could raise your blood pressure. So one of the advices when you're managing somebody's blood pressure is just tell them to reduce their alcohol intake. So that's something that should be aware. So there is no direct link between alcohol and kidney damage. It's an indirect relationship. So now you talk about mild, moderate. I mean, when you say moderate, most people take alcohol in moderation. They go out over the weekend and have a glass of wine or something, and don't drink during the week. So we know the number of units, 21 units, averagely, which is recommended by the Food and Drug Agency, which will be less harmful. That is harmful directly to the liver. You understand, to other things in the body. But alcohol on its own does not have direct impact on the kidneys, but it can have the indirect impact on the kidneys through your blood pressure. Yeah.
Okay. All right. Professor, thank you very, very, very much. We seem to have run out of questions. I must say that your answers have been rather thought-provoking, and as the answers kept coming, the questions kept coming. So I must congratulate you on your powers of explanation, if you want. I will, at this stage, ask everyone to join me in saying a big thank you to Prof. And we hope that we will see him again in the future, either for a recap or for a talk on something else medical. I would like to hand over to my colleague, Natasha, who will give us some more information from Khan and Katib. But thank you very much, everyone, for attending. It's been very nice.
Thank you.
Apologies. Hello all. That was a very insightful session. Thank you, docs. I really enjoyed all the questions, very day-to-day things that can really be used for everyone. So thank you as well for the people that are participating. We can see all the thank yous on the chat from Gemma, Carmen, Pamela. We appreciate you, and I'm sure Dr. Hebe and Dr. Sapong are very pleased to see that. So thanks. So I wanted to just going to put all the links on the chat really quick for you regarding what I'm going to speak to you about just now. Let me share my screen. Great. I think you can all see my screen. Yeah. Perfect. So this is about the session of next week for Health Hour. So men's not hot, a little play on words there to call your attention for Black men's health and men's health in general. Obviously, we are targeting Black people. That's the community we serve, but everyone is welcome. We really want to talk about screening opportunities, early signs of certain illnesses, and really just bring forward the agenda that Black men should prioritize their health. You are not made of iron, and it's important to get checked. So yes, join us next Saturday at 11 a.m. as always with Dr. Hector Goma. On the subject of health, as always, we have our Healthy Heart sessions next week on Tuesday, 6:30, building positive networks for nutrition and lifestyle. So we talk everything about diet, nutrition, always tailored to the Caribbean and African community. We have Dr. Hiba, as the host, and we also have our guest speaker, Dr. Evans, and our physical instruction. If you want to get a bit of a boogie and get warmed up in these cold days, it's perfect to wrap up the session with Orlando. So do register. The links are on the chat, but it's also all across kind of social media. We have a really, really big event to close the year. It is free. It is open to all for Manchester and beyond. So it's the Greater Manchester Caribbean and African Community Carol Service. So this day will be full of choirs of our community. We'll have an orchestra with musicians. We'll have singers. Very beautiful readings for many leaders across our community. We'll also have refreshments, and it's just a little, very nice way to end the day on Monday. So join us at 7 p.m. at the Manchester Cathedral. I really look forward to seeing you there. You can register in the portal, or you can simply show up. Obviously, we encourage registering, but do show up at 7 p.m. at the Manchester Cathedral with your family and friends. Now on Stockport, we are calling all of Stockport residents to come and participate in our Green Arts workshops. They are completely free, and they're really focused in Caribbean and African art, history, culture. The work that is being produced by the people using the service in Bolton and other parts of Manchester is really incredible. You have some images there of them doing art, but really, I'll incentivize anyone around Stockport to join this beautiful activity, this Green Arts workshops. Now, another opportunity for parents and guardians, more specifically around Manchester, just because of, traveling, because this is an in-person course, really focused on improving the relationships between children and their parents and guardians, managing stress, perhaps managing, growth stages that they have when they become teenagers and other things, any things that might arise, any challenges that you might be facing right now, you will be able to get help in this program and just feel more knowledgeable and empowered. So it will be in person. It starts in January. So I would really encourage you to register, because I know the spots are filling in. Again, the links are in the chat. And we're doing, CAN does a lot of research as well. So we are having a Get Justice consultation. We're working with the ombudsman from the government. So it's about breaking barriers and justice. This justice consultation is really for, we're trying to gather data on anyone and opinions and hear you about challenges that you might face in various areas. Is it criminal justice? Is it pension that you might have been denied, or difficulty accessing to public services, windrush compensation? So a series of things that is compensation for your participation online and also in person. That is a £25 and a £30 voucher thing. So do participate, reach out to us. Last but not least, I said the last event of the year was the Carol Service, but actually I think it might be this one. So it's a pampering day, a Christmas pampering day, again, free for mums around Manchester. Please come and join us. You'd have to register for this one. It's very important. It's on the 16th of December. In the morning, mid 11 to 4. Children have bouncy castle, face painting, other games and activities for them to distract while you receive massages, a chance to socialize with other moms, and there'll also be refreshments. So we are very happy to welcome you. Do join us. So that's it for the kind of dates, but I just wanted to once more highlight that if you want to get in touch with us, there is a contact for Sandra Yati and an email address if you have any questions on Health Hour. And our partners' contacts are also going to be on the screen now for Enfield Caribbean Association, for Rafa International Development Agency, here for the Royal Assembly Regime Christian Church of God in Sheffield, Croydon BME Forum, contact as well on the screen, and finally, the Black Health Initiative, BHI, contact also on the screen. If you ever need any of their contacts, do get in touch with us at help@canada.org.uk, or if you want any of the slides, also use that email. Thank you to all of our partners, to our listeners, viewers, to the doctors that facilitate this sessions, and I shall see you next week. Bye-bye.
Thank you. Thank you very much.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Mm.